Good afternoon and welcome to GPA Live. I'm Ron Aaron Eisenberg, your host for this program, and we come to you for December every other week. And then beginning in January, we go back to weekly programs for GPA Live, and we look forward to that as well. This program is an education series produced by the Global Pain Association, and today we'll be talking about physical therapy as a treatment for chronic pain. Our special guest is Edwin Serrano. He's a physical therapist. Dr. Serrano is a doctor of physical therapy and owner of Positive Action Rehab and Performance. And I'm pleased to tell you that this week's sponsor is the Alamo Area Council of Governments.
Older adults are more likely to suffer from chronic pain and illnesses, making them more susceptible to addiction of prescription opioids. Even at prescribed doses, there are other risks, such as increased rate of falls and fractures. The Alamo and Bear Area Agencies on Aging have collaborated with the Texas Health and Human Services Commission to address opioid misuse among older adults. For resources, please call 210-477-3275 or toll free at 866-231-4922.
Dr. Susan Blackwood is the founder and executive director for the Global Pain Association, and every week she joins us on GPA Live. Dr. Blackwood is not only knowledgeable about the organization, but has a great deal of information on chronic pain as well, and has been experienced in dealing with folks who have chronic pain. Dr. Blackwood, thanks for joining us.
Good afternoon, Ron, and thanks to you and the Eisenberg Group. You know, we've now done 27 of these segments since May. We now have over 55,000 people following us, and we're just thrilled that we've been able, in a pandemic, to be able to do a pivot and bring these to people at home. And we've had great topics. And now the board has voted to start again in January weekly. So we'll have Saturday noon live every week. And at the beginning of the year, we've got some great topics for people to get started with 2021. How to eat right, how to exercise right. It's just going to be fabulous.
Well, thank you for thinking of putting this all together. And it was certainly a way to deal with the pandemic. There was no way to do the kind of seminar you did last spring, where you brought together a lot of people. But today, we don't bring together a lot of people live and in a room, but virtually we can do that. And for folks who want more information about the Global Pain Association, Susan, where do we get it?
They can go to our website, www.globalpain.org, and they'll have lots of resources there. They can watch the virtual series that we've been doing since May on our website, and have lots of other resources and articles that will help them. And if they feel like they want to help us keep this series going, they can even go to that site. There's a donate button, and they can make a donation and help us keep the series alive.
And all the shows that we have done are available to view.
Absolutely, both on our Facebook page and on our website. So we really appreciate everybody's support. We wish them a great holiday, and we can't wait to see them again at the beginning of the month, January 2021.
Thank you very much. Appreciate you doing all this, and we'll catch you later, if not on this program, on our next GPA Live. Today's program is focusing on how you can use physical therapy to address chronic pain. Our special guest is Edwin Serrano. Dr. Serrano has a Bachelor of Science in Kinesiology from Our Lady of the Lake University, a Doctor of Physical Therapy from the University of the Incarnate Word. He is owner of Positive Action Rehab and Performance. Dr. Serrano, welcome to GPA Live.
Thank you, Ron, for having me. It's a pleasure to be here.
Well, it's really great to see you. And I had mentioned to you off the air that on SportsCenter on ESPN today, they introduced the chief physical therapist for the National Football League, who deals with injuries to players. And it is a position I didn't know they had.
Yeah, we are everywhere in any sport. You know, we treat all kinds of people, from young to geriatrics to athletic population and injury prevention.
Well, tell us more about your practice and the patients you work with.
Yes, so my practice, of course, is positive action rehab and performance. I am the owner along with my wife, and it's a performance-based clinic, meaning we're not insurance-based. We tend to spend, about an hour total with our patients, and it's all one-on-one, and we help all individuals. The big thing is, yeah, we do work with the athletic population, but we have also worked with many individuals with chronic pain and getting them back to an active and more healthy lifestyle. And it helps manage their pain as well as it has been able to go away in some situations, which is a good thing.
Well, tell me a little bit about chronic pain. And if, for example, we wait 6 months or longer to seek help with our chronic
hmm
pain, is it possible for a physical therapist to help us? Can waiting so long cause permanent damage?
Yeah, so we know that chronic pain is pain that lasts, longer than the normal healing times. And typically, that takes 3 to 6 months. That's when you're diagnosed with chronic pain. But, you know, I advise people to go to a physical therapist right away as soon as you start feeling any pain, because the sooner you can treat any type of acute pain, the sooner you will get rid of it, or make it feel better, right? So we look at this diagram here. If you have a sprained ankle, and you have tissue damage, we know that it goes exactly to the brain. The brain tells you how to react. And let's say you let this ankle sprain linger, or you're hobbling along. Well, then what tends to happen is you build up sensitivity, kind of like a very sensitized alarm system on your car. So if you do not expose it to movement, to strengthening, to things like this, then you start developing chronic pain, which at that point we can still help. It just becomes harder to get rid of because we've built up such a sensitive nervous system.
Jumped on board
And
to say happy holidays, stay safe, everyone. I want to remind Lisa and all of you, you can share this educational program with your Facebook friends. And if you share it, you expand the number of people who are exposed to GPA Live. So I encourage you to go ahead and do that. And Edwin, you talk about
mhm,
healing times. Do
yes.
you recommend, as you said, see a physical therapist if the pain persists after normal healing time or immediately
mhm.
after we feel pain?
Yes, so I mean, if we look at here, we look at normal healing times. And I think this is very a good educational piece for people because you have things that take a long time to heal, but yet we want to get rid of pain. So if you were to go see us, whether it be 6 months later or right after, we know that we have a normal healing time that we have to adhere to. So a normal thing that you always hear is, oh, I have bulging discs. Well, your discs are made out of collagen. It takes 300 days to completely heal. So if you're having some back pain and you're expecting to get healed in a matter of weeks, well, it might take close to a year to get better. So it's really good to educate yourself on the normal healing times and know that physical therapy is there to help throughout that time to help with graded exposure into movement.
Now, I thought I heard you say go to your physical therapist before your primary care doctor or before you get an
hmm
MRI or an x ray. It could be
hmm
more cost effective. But don't we need a referral?
So it varies with state to state, but in Texas we do have what we call direct access. There's a lot of details to it or whatnot, but basically, if you have any kind of pain right off the bat, you can definitely come to us. And sometimes it's harder to get into a physician's office. Sometimes it takes longer. Typically, we'd like to see you, and especially in my practice, within 24 hours, so we can get you in. The sooner we can get you taken care of, the less likely you are to develop any kind of chronic pain. Now, we find anything that requires any kind of imaging, we can always refer out. You know, so remember, we get this question all the time. I've had back pain for years. Why do I still hurt? Well, we develop pain over time. This happens because of how we do what we do every day, how we bend over, how we bend over to pick something up, how we sit down on the couch. So going with a physical therapist and going through a movement assessment will really help, target those things and help you long term. Pain is there initially to, protect us, but as we get better and things heal, we need to be able to have graded exposure, bend slowly, get to 25% of movement, then 50%, then work our way to 100%. Um, one of my favorite sayings is the straw that broke the camel's back, right? You do things over and over again you don't feel anything, but eventually you have that one tweak in your back, that one tweak in your ankle. Well, a physical therapist can help you with moving better, getting stronger, and getting you ready for living life.
Bit. Talk to me a little bit about X-rays and MRIs.
hmm
Do they really,
So
really tell us about pain?
yeah, so there's for any study out there, there's a study, but physical therapists are trained in many special tests, and I tell people we're like walking MRIs. So if you can come to us right away, it's definitely more cost effective and it saves you on time. If we look at this model here, you can see how long it would take for someone to get into physical therapy and going through the long pathway there. And by the time you see a physical therapist, the average time is about 45 days. Well, if you were to come to us immediately, it would not only save you money, but it would also save you time. And we know that the longer that you're in pain, the more likely you are to develop chronic pain. Um, biggest thing in imaging is, they talk about arthritis. It's like I tell people it's like gray hair. Obviously, there's different types of arthritis, but the normal aging one, osteoarthritis, it's like gray hair. We all get it, and we need to move better and get stronger in order to improve our pain and improve any arthritic changes within our body.
It's interesting. It sounds counterintuitive. If something hurts,
hmm
if you have arthritis, moving and exercising will be
hmm
helpful, even though it hurts.
Yes. Yes, so and that's where the graded exposure comes into play. Obviously, if you move too much in too fast of a time, then your body's going to try and protect you. It's going to send off that alarm system, and you're going to want to not move, and you're going to want to lay there and do nothing. And it's all about moving slowly and whatever your body can tolerate to get you out of that pain.
Physical therapists
So,
do.
yeah.
What,
So, yes, go ahead.
I was
Sorry.
going to say, how can a physical therapist help us? And I see this slide. Talk to me about it.
hmm Yeah, so initially when someone walks into physical therapy, we diagnose an issue, we see that they're having pain, but we not only look at you and ask you all these questions, we take an hour and a half at times, and we look at how you're moving, any strength deficits, what things may be contributing to your pain and your dysfunction at the time, and then how can we manage it. So typically, a treatment approach for physical therapy can last up to 6 weeks, even longer. I've worked with people that have had chronic pain, and sometimes we work for months at a time, but you're having a diligent approach to getting back to an active lifestyle. At the same time, we help with injury prevention, and then we develop tailored plans according to you. And we not only look at the physical side of it, but any patient that we get, typically we address diet and lifestyle. We know that anytime you've had chronic pain, we know that there may have been other stressors in your life, whether they be financial or social, and we help you address those things. It's like a holistic approach to well-being. So this is kind of sums everything up. And like I said, if we feel like at the end of the day we cannot help you, we refer you out to get better help. So we address your sleep, your diet, exercise, and your pain as well.
Now, what
So
haven't,
again, mhm.
pardon me, what haven't I asked you that you might want to add to what we talked about?
When I guess when dealing with chronic pain, I deal with this all the time where people feel that they can't get help, that there's no other option but surgery or medication. Um, and you need to get out there and you need to get help. And a physical therapist is a good starting point. There may be times that you're in more pain, there may be times that you feel better, but getting better is not always an upward slope or a downward slope. I always tell people it's a roller coaster. Days you're going to feel better, days you're going to feel worse, and we just have to, trust the process of getting better and moving more.
And I saw you offer a no charge free assessment if people call you.
Yes, so we do a free assessment. We think that if you're going to spend money on us, we want to, show you what we can do. So, we see typically people on the first eval for about an hour, hour and a half, but we do the first 30 minutes for free, and we give you, we give you a picture of what you're dealing with, and then from there, if you decide to stay, we'll go from there, and if you decide not to, you didn't waste anything but your time.
Well, I want to thank you very much for coming on And for folks who
Yes,
want to get a hold of you, your email address is right there next to your name, Dr.
Yes.
Edwin Serrano. And Edwin, thank you. It was very, very informative.
Yes, thank you very much for having me.
Okay.
I appreciate it.
You take care. Today's program, we want to thank the Alamo Area Council of Governments for supporting today's segment.
Older adults are more likely to suffer from chronic pain and illnesses, making them more susceptible to addiction of prescription opioids. Even at prescribed doses, there are other risks, such as increased rate of falls and fractures. The Alamo and Bear Area Agencies on Aging have collaborated with the Texas Health and Human Services Commission to address opioid misuse among older adults. For resources, please call 210-477-3275 or toll free at 866-231-4922.
Well, that was very interesting. I want to welcome back Susan Blackwood, who, as I had mentioned earlier in the program, was the founder and genius behind the Global Pain Association and GPA Live, which is where we are talking today. Susan, we lost a dear friend of yours and others on the board at the Global Pain Association, someone who worked tirelessly as a chronic pain warrior. I'm talking about Rebecca Christopherson. She died November 24th after fighting COVID pneumonia for a month. She beat cancer, she beat all kinds of issues, and then COVID got her. Tell us about Rebecca.
Well, thank you, Ron, for letting us have some time to tell people how important Rebecca was to this organization. Besides being a global pain board member, she was the wife of Chad, the mother of Aiden and Bryce, and an amazing woman. She gave of herself time and time again, both as a social worker and a nurse and a counselor, because she loved helping people. She worked at MD Anderson Hospital, providing counseling and assistance to families of cancer before she was a patient herself. She was really proud of her children. Her main job, as she put it, was being a mother for her children and making sure they had the skills and drive necessary to succeed in this challenging world. And we know that they have lived up to her promise and her commitment. December 23rd would have been Rebecca and Chad's 25th wedding anniversary. And her four-legged family members, her dogs, who were very devoted to her as she was to them, will be helping celebrate that anniversary. She saw the best of everyone. She was a great friend, and she encouraged people with her stories, her overcoming adversity. She was a superpower to our organization. We have decided, in her honor and in her memory, just to do something that she had wanted us to do since day one, and that's to start a support group for people with chronic pain. And I'm just so happy to tell you that will start in January on the 9th. We'll be calling it the Global Pain Warriors. It'll be a support group that will be facilitated by Dr. Marianne Pinkston, and we're just thrilled to do this in Rebecca's honor. Her family knew how much she loved Global Pain Association, and if people want to make a donation in her memory, they can do that on the globalpain.org website under donate, and there will be a story about Rebecca, and you can obviously make a contribution in her memory and in her honor. She would have wanted this to be an organization that makes a better world for people with chronic pain, and she did everything possible to make that happen and to make sure that we had her inspiration going forward. I know her family will be supported by Global Pain Association and our friends. And I just wish them all the luck as we get through this holiday season without her. Thank you, Ron.
Thank you, Susan. I know how difficult that was. And we appreciate you sharing that. Rebecca Christopherson will be long remembered by her friends and by literally the thousands of people that she touched in her work. And we want to take a moment to encourage you. If you want to donate in her memory, do so. If you struggle with chronic pain, you might want to join the new Chronic Pain Association's group therapy program, and it can be a help to you as well. And I want to thank all of you who joined us today. We'll be back in 2 weeks. Saturday, January 2nd at noon, right here on Facebook Live for GPA Live. The topic, what is the Global Pain Association? Who are we? What do we do? How can you get involved? And if you got a question you want asked, email those of us at info@globalpain.org. And starting in January, we'll come to you every Saturday, every week at noon for GPA Live. Thanks for joining us, and I will see you in 2 weeks on GPA Live. Have a great day, everybody.